So today's question is, an oncologist wants to pursue his research paper on the activity of telomerase in malignancies. So one of his patients, a 30-year-old female, was diagnosed to have breast carcinoma. She was having a family history of breast cancer. Which of the following is true regarding the telomerase activity? It's an RNA-dependent DNA polymerase. Cancer cells have high level of telomerase activity. Cancer cells have low levels of telomerase activity, both A and B. So it's about cancer and the expression of telomerase. So before that, you should know what is telomerase. So telomerase is an enzyme which is going to replenish the length of the telomeres. So what are telomeres? So when you take a chromosome, you have a centromere. The ends are called telomeres. Okay. So usually what happens, these telomeres contain repeat sequences of DNA, repeat stretches of DNA. Okay. So sometimes during cell division, these telomeres may get lost. So they are replenished with the help of telomerase enzyme. So they help in maintaining the length of the telomere. Or else if the length is not maintained, some information might get gone away like that. Okay. So telomerase is going to establish the length of the telomere. So during aging, what happens? The activity of this enzyme goes low. The telomerase activity goes low. So the telomeres are not maintained. The length of the telomeres gets shortened as you age. Okay. So what happens in your body cells? You have somatic cells, you have stem cells, you have germ cells. Okay. So what happens to the telomerase activity in these conditions? Your somatic cells doesn't have any telomerase activity. Your stem cells have low level of telomerase activity. Germ cells have a high amount of telomerase activity. So this is the telomerase activity in different cells of your body. Okay. So what happens in malignancy? So if you have read the neoplasia chapter, you have certain characters of neoplasia. That is, they grow even without the presence of growth factors, like self-sufficient in growth factors. They are not sensitive to growth inhibitors. Like that, you have so many properties. Like that, immortality is a property of cancer cells. They don't die. So why do those cancer cells don't die? That's because they have high level of telomerase activity, which is going to maintain the length of the telomere, so they don't die. Okay. So telomerase is an RNA dependent DNA polymerase. Cancer cells have high level of activity. There is no telomerase activity in a somatic cell. Your stem cells have low level of telomerase activity, whereas the germ cells have high level of telomerase activity. As you age, the telomerase activities goes down, whereas in malignancy, the telomerase activity is high. Okay. Thank you. This is about the telomerase. Thank you.